Hey everybody, welcome to Journey to Vitality. In this video, we uncover how to heal your pelvic floor, live pain-free, and rediscover the pleasure your body deserves. Did you know that a weak or tense pelvic floor could be the hidden cause behind chronic pain, discomfort, and even a loss of intimacy? What if you could take steps to heal, strengthen, and reconnect with your body's natural pleasure? We'll explore powerful techniques to help you regain control, live pain-free, and rediscover the joy of a healthy pelvic floor. Common pelvic floor issues and symptoms. Pelvic floor dysfunction can manifest in a variety of ways, impacting both physical comfort and quality of life. One of the most common issues is pelvic pain, which can range from a dull ache to sharp, debilitating sensations. This pain often arises from muscle tension, nerve irritation, or inflammation. Conditions like chronic pelvic pain syndrome and vulvodynia are associated with this type of discomfort and can severely affect day-to-day activities and sexual health. Incontinence is another prevalent pelvic floor issue. It can present as urinary incontinence, where individuals experience involuntary leakage of urine, or fecal incontinence, which involves a loss of control over bowel movements. Urinary incontinence often results from weakened pelvic muscles or bladder overactivity, while fecal incontinence is commonly linked to muscle or nerve damage within the pelvic region. Pelvic organ prolapse is a condition where pelvic organs such as the bladder, uterus, or rectum protrude into the vaginal wall due to weakened pelvic support structures. Symptoms of prolapse can include a feeling of heaviness or pressure in the pelvic region, discomfort during physical activities, and noticeable bulging at the vaginal opening. This condition is frequently seen in women who have had multiple childbirths or those experiencing age-related muscle weakening. The impact of pelvic floor dysfunction on daily life. Pelvic floor dysfunction can profoundly affect many aspects of daily life, often in ways that are not immediately visible to others. Individuals suffering from this condition may experience a range of symptoms, including chronic pain, urinary incontinence, and sexual dysfunction. These issues can disrupt everyday activities and routines, making tasks that were once easy or taken for granted challenging or even impossible. For example, urinary incontinence can lead to frequent, uncontrollable urges to urinate, causing distress and discomfort during social or professional interactions. Chronic pelvic pain, another common symptom, can be debilitating and impact a person's ability to engage in everyday activities. This persistent pain can interfere with work, exercise, and essential self-care. Individuals may avoid specific movements or activities to prevent exacerbating their symptoms, which can lead to decreased physical fitness and overall quality of life. Pelvic floor dysfunction can also significantly impact interpersonal relationships and social interactions. The discomfort and embarrassment associated with symptoms like incontinence or pain can lead to social withdrawal and decreased participation in activities with family and friends. This isolation can strain relationships, as partners and loved ones may struggle to understand the impact of these issues on daily life, potentially leading to frustration and feelings of disconnection. Effective exercises for pelvic floor rehabilitation. Pelvic floor exercises are crucial for restoring and maintaining the health of the pelvic floor muscles, which support the bladder, uterus, and rectum. One of the most effective exercises is the Kegel exercise, named after Dr. Arnold Kegel, who popularized them in the 1940s. Kegels involve contracting and relaxing the pelvic floor muscles, and they can help address issues such as urinary incontinence and pelvic pain. To perform a Kegel, tighten the muscles as if trying to stop the urine flow, hold for a few seconds, and then relax. Repeating this exercise 10 to 15 times per session, 3 times a day, can strengthen these muscles over time. In addition to Kegels, pelvic tilts are another beneficial exercise. This exercise involves lying on your back with your knees bent and feet flat on the floor. Gently tilt your pelvis upward, flattening the lower back against the floor, and then release. Pelvic tilts help improve core stability and reduce lower back pain, which often accompanies pelvic floor dysfunction. Performing 10-15 pelvic tilts in sets 2 to 3 times daily can enhance muscle coordination and overall pelvic health. Bridges are another effective exercise that targets the pelvic floor, glutes, and core. To do a bridge, lie on your back with your knees bent and feet hip-width apart. Lift your hips toward the ceiling while squeezing your glutes and pelvic floor muscles. Hold the position for a few seconds before slowly lowering your hips back down. This exercise not only strengthens the pelvic floor, but also promotes stability in the lower body. Aim for 10-15 repetitions in 2 to 3 sets each day. Breathing techniques to support pelvic floor health. Breathing techniques support pelvic floor health as they help regulate intra-abdominal pressure and facilitate proper muscle function. One of the most effective methods is diaphragmatic breathing, which engages the diaphragm and promotes relaxation of the pelvic floor muscles. By focusing on deep, slow breaths, you can help reduce tension and stress in the pelvic area. Diaphragmatic breathing encourages a rhythmic rise and fall of the abdomen, allowing the pelvic floor muscles to naturally contract and relax with each breath. Another beneficial technique is abdominal breathing. This method involves inhaling deeply through the nose, allowing the abdomen to expand, and then exhaling slowly through the mouth. This approach helps to strengthen the core muscles and stabilize the pelvis. Abdominal breathing is particularly useful for individuals experiencing pelvic pain or discomfort, as it helps to manage pressure and prevent excessive straining, which can exacerbate symptoms. Pursed lip breathing can also be valuable for pelvic floor health. This technique involves inhaling through the nose and then exhaling slowly through pursed lips. Pursed lip breathing promotes a steady, controlled exhalation, which can help manage intra-abdominal pressure and reduce strain on the pelvic floor. This method benefits individuals who experience pelvic pressure or have difficulty controlling their breath during physical activities. The role of physical therapy in pelvic floor healing. Physical therapy is a cornerstone in the treatment and rehabilitation of pelvic floor dysfunction. Specialized pelvic floor physical therapists are trained to address issues related to the muscles and connective tissues of the pelvic region. These professionals use manual techniques, exercises, and education to help individuals manage pain, improve function, and enhance quality of life. Pelvic floor physical therapy focuses on identifying and treating the specific issues affecting an individual's pelvic floor, whether it's weakness, tightness, or coordination problems. One of the primary techniques used in pelvic floor physical therapy is biofeedback. This approach uses sensors to provide real-time data on pelvic floor muscle activity. Lifestyle changes to improve pelvic floor health. Diet and nutrition. Maintaining a balanced diet is crucial for pelvic floor health. A fiber-rich diet helps prevent constipation, which can put additional pressure on the pelvic floor muscles. Foods like fruits, vegetables, whole grains, and legumes promote regular bowel movements. Staying hydrated is equally essential. Drinking sufficient water ensures urine remains dilute, reducing irritation and stress on the pelvic muscles. Reducing the intake of caffeine and alcohol can also help, as these substances can irritate the bladder and exacerbate symptoms of pelvic floor dysfunction. Weight management. Excess body weight can strain the pelvic floor muscles, leading to weakened support and increased risk of conditions such as prolapse. Maintaining a healthy weight through a balanced diet and regular exercise can alleviate this pressure. Engaging in low-impact activities like swimming, walking, or cycling can effectively manage weight while minimizing strain on the pelvic area. For those significantly overweight, seeking guidance from a healthcare provider can provide a personalized plan to achieve and maintain a healthy weight. Posture and body mechanics. Proper posture and body mechanics play a significant role in pelvic floor health. Poor posture, such as slouching or sitting for extended periods, can contribute to pelvic floor dysfunction by increasing pressure on the pelvic area. Practicing good posture, sitting upright with feet flat on the floor and shoulders back, can alleviate unnecessary pressure on the pelvic floor. In conclusion, healing your pelvic floor is a transformative journey that not only alleviates pain, but also enhances your overall well-being and pleasure. By incorporating targeted exercises, proper breathing techniques, and lifestyle changes, you can restore strength and balance to your pelvic floor, leading to a pain-free and more fulfilling life. Remember, consistency and patience are key. Every step you take brings you closer to reclaiming control over your body and enjoying the pleasures of a healthy pelvic floor. If you found these tips helpful and are ready to take control of your pelvic floor health, don't forget to hit that subscribe button for more valuable insights and updates. Share this video with anyone who might benefit, and leave your thoughts or questions in the comments below. Until next time, stay happy and healthy.